Well, Martin, junior doctors have been overworked and underpaid for many years now. And in the UK, good health in our population is the bedrock for getting the UK economy growing again back to its best. So we need an NHS that's able to deliver elective care for our parents, operations, A&E service when our children need it. And that means we need doctors in our hospitals paid fairly, motivated to be there, rather than leaving for Australia, which many of my colleagues have been doing throughout the year that I've been working. So I think we need to invest in our health service. This is a crucial first step to do so.
What about the notion that a lot of people are saying, wow, hey presto, as if by magic, this has been resolved 5 minutes into a Labour term. Is there a political element to this? Were the junior doctors and the unions simply unprepared to negotiate with the Conservatives, and as soon as Labour get in, wallop, it's a done deal?
I think there were really genuine frustrations felt by junior doctors over recent years, exhaustion off the back of COVID and previously, but also the sense that pay wasn't keeping up with cost of living. I have colleagues who couldn't pay rent and pay their student loans off. And this is the first pay deal that listens to those concerns seriously, that embeds a pay rise that considers that, but also that talks about other concerns. So rotational training around the country that took where people live out of their control, sending people off to Plymouth with a few weeks' notice. I think that this deal puts staff wellbeing first and therefore puts our patients' wellbeing first as well.
So Annie, putting your economist's hat on now, we had Rachel Reeves in the Commons earlier on today saying we've got this super massive black hole, £22 billion a year. How does adding $5 billion to that black hole by paying junior doctors help?
Well, investing in our health is an investment in our potential to grow again. We need to provide the knee operations that allow someone to go back to work, or the heart surgery appointment that someone needs to stay healthy. So at the moment, with millions of people economically inactive in the UK, that's terrible for the people that we love, first and foremost, but also is bad for our economy. For once, actually, putting the NHS at the heart of investment, of planning here in the future, I think is a way to actually tackle that sort of long-term sickness that's currently holding the UK back.
But don't you think there's an argument to say that the NHS is constantly getting billions and billions of pounds? It's the biggest recipient of every pound that we pay in tax by a country mile. We seem to throw more and more money at it. Nothing seems to improve in terms of outcome. Why does this pay rise? You keep saying very sensible stuff about if we're all healthier, we can work more. But throwing money at the problem doesn't seem to have solved it. Isn't there a different solution? How about looking at part privatising the NHS? Now, Wes Streeting talked about that pre-election, as well as giving you guys a pay rise today. Would that cause you to maybe consider going on a strike if there were to be this notion of let's modernise? Let's do something that people like Nigel Farage have said for a long time and look at this partnership between private and the NHS, introduced first by Tony Blair.
Well, Martin, I think one aspect of what you're saying there, that a pay deal is only part of fixing the NHS, is right. We need to think about how we build the service back to its best. The way I would do that, and what we've advocated for at IPPR, is firstly starting with prevention, building a healthier population. That means people being able to see their GPs again, but also thinking about supporting healthy lifestyles, spaces for sport, more affordable, healthy food. But then also it means within the NHS, listening to staff before we get to the point of a strike. So right now, staff have had to strike to have negotiations over pay. Going forward, we need to embed staff voice in those negotiations and listen in advance to doctors, but also to nurses, to others. That's more affordable for everyone. It's more sustainable, and it means the system can deliver without looking at a two-tier privatised system that would be more unfair for the patients that I see every day.
What would you say to the point, Annie, that you've had a result today, a complete result, 22% pay rise, and now you mentioned your colleagues there, nurses, paramedics, all sorts of other workers, GPs, they'll be licking their lips at the prospect of the fact that this Labour Party seems to be on a pay rise giveaway.
Well, I think that's where we need to think about longer-term solutions to listening to staff in the NHS. So today is a first step, and it's an important one to resolve the doctors' dispute. But going forward, we do need to listen to the frustrations of nurses, of paramedics, of physios, and that means building structures where, rather than currently you have a pay review body that just picks a number, staff have a choice to accept it or to go on strike. Strike becomes the only resort, not the last resort. Instead, we need a real system that listens. So that means proactively embedding staff in those negotiations, reforming the pay review process, and more widely, working conditions to make the NHS work better for my colleagues and for the patients that we care about.
Very quickly, do you think it's morally acceptable for doctors or nurses at all to ever go on strike? Your job's meant to be saving lives, not endangering them by going on strike.
I think in certain cases, striking for the health of the NHS and its ability to deliver for patients in the future is a commitment to our values to serve the public themselves.
Okay, superb. Thank you very much for joining us, Annie Williamson. Superb stuff.